Meet Hilda. She's 61, here for a routine checkup, and feels completely fine. No pain, no shortness of breath, nothing at all. But when her blood pressure is checked at 2 separate visits, the numbers are consistently high. That's hypertension. First, let's notice something important. Most people with high blood pressure have no symptoms. Hilda feels normal, and that's typical. Symptoms like headaches, dizziness, palpitations, blurred vision, chest pain, or shortness of breath usually show up later or when the cause is secondary. By then, damage may already be happening. Diagnosing hypertension is simple and quiet. 2 or more elevated readings taken at 2 different appointments. No dramatic lab result, no alarming ECG, just a repeated number telling us the force of blood against the vessel walls is too high, over and over again. So what does that number mean? Blood pressure is the force blood exerts on blood vessels as the heart pumps. It rises when there's more fluid in the system, when vessels are narrowed, or when vessel walls become stiff with age. Most cases are primary, meaning there's no single cause. Genetics, salt intake, excess weight, smoking, alcohol, stress, inactivity, and aging all contribute. Sometimes it's secondary, caused by something identifiable like sleep apnea or kidney disease. This matters because hypertension is a silent killer. High pressure quietly injures the smallest blood vessels, and the heart works harder with every beat. By the time symptoms appear, organ damage may already be underway. Now let's respond. If there's a secondary cause, we fix that. For primary hypertension, treatment starts with lifestyle changes. Exercise, less sodium, no nicotine, less alcohol, and better control of cholesterol and blood sugar. Medications depend on severity. Stage 1 usually means lifestyle changes plus 1 drug, often a thiazide or thiazide-like diuretic. Other medication classes relax blood vessels. Stage 2 usually requires 2 medications working together. The goal is simple: keep blood pressure below 130/80. Finally, let's reflect. If treatment works, nothing happens. The numbers come down and stay down. No symptoms appear. But if hypertension goes unrecognized or untreated, the complications include strokes, kidney failure, heart disease, and blindness. In summary, hypertension is a chronically elevated force of blood against vessel walls, commonly without any symptoms. This increased fluid volume or constricted and stiffened vessels raise the pressure the heart must pump against, silently damaging small vessels throughout the body over time. The most common treatments are lifestyle changes plus antihypertensives, beginning with a diuretic and a goal blood pressure below 130/80. If you study to remember, you will forget. But if you study to understand, you will remember. Author unknown.